Just wanted to welcome everyone. My name is Erik Alexander. I'm the Executive Director of the Brigham Education Institute. I'm here with many of my fellow teammates and colleagues within the BEI, and I'll introduce the segment here upcoming. But just to welcome to everyone, a few quick things for the program. We always do record these programs for others and for future benefit. And so if you don't want your face on the recording, obviously just turn off your video. Separate from that, please remember that we do monitor the chat box. Christina DeZara is our monitor today, so feel free to contribute through the chat functionality as well. With that, I'm going to share my screen here and welcome you to the second in our series here on artificial intelligence as it relates to clinical education, especially in medicine. As I mentioned, I'm Erik Alexander, and I'll be the lead on this session. And I just want to put this in perspective before we get started. We, with the thanks to Nerith for putting this together and being the holistic lead, we have put together a 5-part series that we find really exciting and forward-looking. Hopefully you were able to join for the first session, which was just the grounding and the basics of artificial intelligence. So thanks to Yigal Rosen as well for one of our core faculty leading us through that. I get the excitement today of really just speaking about the promise of what lies ahead and can this really happen. I invite you then to put in your calendar October 21st and November 11th. These are going to be real world applications from leading educators in the industry, actually, who are going to talk to us about how AI is impacting assessment in the real world and then also learning itself. And then, of course, we'll finish it off in December with a live hackathon. So hopefully we got a lot more to come here. We're all very excited. Before I get started, I just want to keep in front of everyone as well. We will again start our annual Fundamentals of Education Research, or the PRIZE series over the course of the year, beginning October 12th, ending in June, for anyone who may be interested in advancing their skills as a medical educator, researcher, or writer. These are excellent sessions, and we invite you to join any or all of them. For those who have enjoyed the conversational global aspect of talking about topics in medical education, our Global Medical Education Cafe has been a fabulous venue. Really people from all around the world, different medical schools. We ground it with a topic, and upcoming it will be well-being and resilience for our October 6th discussion. I invite you to come to that. And then if you just want to grow your own skills like we all do in medical education, we anchor off of a very simple process using academic medicine's last page to just come with a no preparation ability to sit down, reflect, and grow your abilities on a topic. So that next one is coming up October 15th. Christina DeZara is our lead for this series. Okay, I'm going to jump in and we'll try and have some stopping points and areas for some discussion, and again invite everyone to weigh in and give your thoughts at any time. But here's what I think we can cover in the next 40 minutes or so, which is to really think about a little bit of an introduction and where we're at in medical education and where we hopefully will be going and why we need to keep evolving and changing. What are the pressures on the system? I'm going to frame this as though I am a real big believer here in artificial intelligence as a way to improve or address some of those problems. And so we'll frame this down the road with just a 10-year out question. When we get to 2031, 10 years from today, what would be the ideal scenario for Brigham or our HMS medical education for students in the clinical clerkships, and what is reality and what seems too far-fetched? And that's where we'll kind of hopefully bring it back together and inspire everyone to be excited about this field. So let me set this up just a little bit. What is the current state in the United States for medical education? So you should know that from the most current AAMC data, there's about a million or so US medical school applications annually for what ends up being 22,000 spots. Now that's not 1 million different individual applicants, because on average, therefore, and we don't know exactly who puts in 10 and who puts in 25, but on average, each individual applicant will apply to about 17 different schools. And we know that the competitive nature of this is, unfortunately, that only about 50% of applicants in any given year will actually be offered a chance to matriculate and enroll. So it's a highly competitive scenario. But look at what happened over the course of the last year. Applicants to United States medical schools are up about 25%. matriculation is actually only up about 15% or growth as new medical schools have come online. And while matriculation is up 15%, total enrollment over the course of that 4 or more year program is up 20%. So what does that mean? How do you make sense of those numbers? It means two things. Medical school has become even harder in which to enroll. It's harder to gain entry, especially in the last 10 years. And once you are enrolled, students are staying longer. Most are pursuing an extra year, sometimes an extra 2 years, whether it's a degree, whether it's research or whatnot. Now that's interesting to note, but it also falls on the back of this. The need for new physicians in the United States is still tremendous. Even though we have expanded US medical schools with about 20 new schools in the last 20 years or so, we will only fill about 75%, about 3/4 of our current US available residency training spots with US medical students. So we could grow it much more. The system, if you will, is still in need of more medical trainees. There are consequences to this, I would argue, and at least my interpretation is that in just 30 years, I mean, really dating back to when I was going to medical school and many even on this call, that to keep up with those pressures, I think increasingly we should all acknowledge that there's really a performance mindset that has only worsened, especially as it relates to getting into medical school, despite our desire for everyone to take on a growth mindset. Also, to perform and create that resume that is really outstanding to try and garner that 50% chance of actually getting accepted. Many people, most people are postponing their initial entry into the process. They're applying now 1, 2, 3 years out from their undergraduate degree. The age of matriculation into medical school is increasing. So yes, we ask the question, are you accepting the students? Are we accepting students that are prepared to be the best doctors or simply the ones who have created the best resume, or maybe both? Now, I will argue that once, if you look back over the 10 or 20 year process, but really the last decade, I think our application of education science to the field of medical training has really improved. And so the kind of paradox, of course, once they're in medical school, we are very focused on competency-based milestones or entrustability and demonstrated ability to move them forward. So here's the reality and the hopeful hypothesis. I think hopefully that shows you we do need more doctors to be trained. We need to expand the training opportunities, both within new and existing schools, to allow for that. But we also need a more efficient system because people are getting older, training is getting longer. And for those who are ready and able, we want them to take the next step. We also need a more reliable and accurate means of knowing when a trainee is indeed ready and able. So therein lies the hypothesis and the point to this talk. I would argue that, and I hope that everyone will agree, and I hope that Igal and Nerith will tell us that artificial intelligence, as it will be applied to medical education ahead, is a big part of that answer. And so I'll even take the current state of affairs and reflect a little bit on Harvard Medical School and the curriculum at hand right now. Arguably an absolutely fabulous curriculum and training what I would argue to be some of the world's best products as they come out on the other end. But can a current medical school curriculum be made more efficient? And I think we all deal still with the problems. How do you deal with the fact that in any new class of about 170 students, there's a wide diversity of learner abilities. There's also a wide diversity of learning styles. And there's also arguably over the course of 3 months, 1 year, 4 years, a large diversity of how each of those talented learners progresses towards an MD degree. And I would ask you just to look kind of at this 4-year block and reflect a little bit. And I think if you did, each acronym, of course, stands for a different class or whatnot. We probably would all agree there are stopping points. There are pieces, assessment points, evaluative points where if we catch that a competency isn't being met, we do have an ability to coach or remediate to catch that before they're moving on to a place where they don't have quite the skill set to succeed. But those stopping catching points are a little bit bulky, right? They're not really too dynamic, and they often exist within a course or over the course of half a year or something like that. So I want to just also set the stage that we're not alone in this, nor are we the cutting edge in this. And I thought I would share a video also from the University of Sydney. This is from earlier this year, so about February or so. They are a broad university discussion here. It's not medical school. It's going to really encompass their entire higher education world. But they, together with Microsoft, have been very focused on artificial intelligence. And so I captured two snippets of their symposium that they put on. The first will be someone here just discussing broadly, how are they thinking about it, at least from a business standpoint, how artificial intelligence can be framed to be thought of to help the university structure. So let's listen for about 60 seconds.
Helping kind of a student customer lens, going, can we get a student a response back faster? Can we improve this overall service to the students? And can we just make their experience here at the university better through the use of AI? On the internal side, it's really kind of the same, very similar, but really with that staff lens of, is there a way to improve the way that staff performs their duties? Can staff do more with less? Or can we enable staff to just be able to do more, deliver more with different tool sets? But the other piece that we spend a lot of bit of time as well is just looking at risks and controls. So AI is really powerful. So instead of doing sample auditing, you can do much more improved and robust controls and risk mitigation with AI. And then in the management side, it's moving the dial on the conversation to go from a kind of a backwards looking to a forwards looking, from a what has happened to a what should we be doing now that we have better information.
And I'll stop there, but I think it's that last point that often hits home a little bit as we really try and move our mindset from what I think we already realized, which is we're at a phase right now, an era where we are capturing huge amounts of data on everything. And we can often retrospectively go and analyze the data, but it's a human endeavor to do that. And I don't think we're always as powerful at the interrogation of the data as we could be, because it's a lot of data and we don't have as much time. So I think what he's getting at there is that the machine itself can be intelligent in kind of informing us of things we might not otherwise know. On the second video here to the right, I'm going to talk about now the second speaker on this symposium, who went through a series in the whole talk, if you're ever interested, of about 10 different case studies in the last year where they were using at the University of Sydney artificial intelligence to improve their educational world in many different ways. I'm going to have him speak. You'll hear him speak on their 8th case example, if you will. And they're going to talk a little bit about how it helped them manage a very unique scenario during the COVID outbreak and how they were dealing with student issues and communication. So take a listen to this.
Deploying AI in higher education. So this next case study I want to talk about is what we affectionately refer to as Chronobot. So when we all got hit by coronavirus back in March of last year, and the university was required to very quickly respond to what I would say is a very fluid environment in terms of how we were going to, basically manage COVID from a university perspective, whether the students were going to come to class, how they were going to come to class, what would happen to the students that are already in country, what would happen to the students who are outside of country who need to come into country, what would happen to the students who are interstate, all these different questions, literally thousands of questions that the 60,000 some odd students in the University of Sydney would have. The university call center teams are just completely overwhelmed. So in a very quick, short period of time, within roughly about a week and a half, we deployed Chronobot. And so Chronobot was a conversational agent that was deployed on all the main university web pages, which allowed the students to ask any kind of question they had related to their studies in coronavirus. And literally we were getting hundreds, if not thousands of questions a day through the bot. The main advantage to the bot for us, aside from just being able to answer the students' questions, any time of the day or night as a normal conversational agent would, was the fact that it gave us some really good data very quickly with regards to what concerns or questions the students had, right? The marketing department and university communications departments, they'd never been through coronavirus or any kind of virus before, like all of us, most companies. They didn't know what issues to cover off, what were things that were most important to students. So by spinning up the spot relatively quickly, populating it with some basic level questions, and then building the content out over the course of several days, if not weeks, we were able to answer the students' questions because we could see where they were asking and answering questions. We had a lot of really good analytics. That's one of the biggest benefits of using virtual agents or chatbots like this, is that you get some really good data in terms of the questions that people are asking, where the bot's being abandoned because it's not addressing certain questions, where there needs to be escalations, these kinds of things.
So to kind of paraphrase and to show at least what caught my ear on that, it's one thing to create a conversational agent because you have 60,000 people calling and it just takes manpower to get any information out. So there's an intelligence there as to how it would address a human question. But the real power and the angle he was exploiting there is, in a week or two's notice, they stood up this platform, and suddenly through the intelligent application or analysis of the data they were getting, they also were beginning to see things that they weren't aware of, that there were questions that were common about a certain aspect, or there were things they hadn't anticipated were commonly being asked about. And I think that is where I start to see, the ability of a machine intelligently to tell us things that we don't often see ourselves.
Deploying AI in higher education.
Helping kind of a student customer.
And I'm going to advance here if I can. There we go. So I had the real fun of being assigned this second talk in this series. And I say fun because it's the one that's also the most forward-looking. It's wonderful to be the speaker for a discussion where you can hypothesize what you want 10 years ahead, and then ask the experts to tell me if this can really be feasible. But that's the excitement of what we want to build here today. So that was the question posed to me. What would I want as an educational leader 10 years down the road for the exact scenario that I oversee right now at Harvard Medical School? So I answered that. And here's what I want. I want a general curriculum that's really not too different from what we have now. I want it grounded in medical science. I want it quickly applied, however, to the patient-facing real world of medicine. I train clinical doctors. That's my first goal. And the student learns by doing, yet with the safety, oversight, and progressive independence that we need. I also still remain grounded in the kind of core fundamentals of education and training in medicine, which is knowledge, its skills, and then its professional behavior attitudes, if you will. But here's what I want in 10 years. I want artificial intelligence to use all the technology that I see around me. I want it to use all of the available data and every single moment of training. And I want it to give me insight on multiple different levels. And I mean all different types of technology. I think Epic is out there. I think we have cameras in many different places. We have the ability to know people are on their various devices and accessing resources regularly. But tell me again, kind of what that speaker was getting at. If I had to know my curriculum, I want to make it adapt better. I wanted to design it more intelligently. So can the machine give me some insight into that? Equally as important, I would really want to know more about my individual students. I think they are all a bit different, but I'm having trouble right now in the traditional model kind of catching that. And then here's a biggie for me, which is, I think, my last 25 years in education has really just seen all of us take, if you will, the kind of common ability to assess someone as a learner, and that is to assess their knowledge, to give them a test, if you will. But I told you I'm all about the other things too, skills and attitude. I think they're just a lot harder to sometimes assess. And so I would love artificial intelligence to give me insight into each of these so that I can look at all three of those aspects equally. And by the way, when you're doing it, make this a lot more efficient so that I can get those students out far quicker than just the 4-year timestamp. So that's what I want. All right, and I want to take each one of these a little bit one by one, because we're going to stop then and pull in our experts to see if my desire is really a possible reality. And I'm going to pull in Igal, and I'm going to pull in then Nerith to kind of answer those questions and tell us, is that really possible? So from a broad curricular standpoint, I'm going to kind of do the now, the soon, and the future. And I would argue right now that much of our curriculum still remains really time-based. When you enroll in medical school, there really are very few ways to get out beyond the 4-year timestamp, right? And those timestamps involve a lot of blocks of content. Now, it logically builds on itself. I think it's a really good curriculum for the holistic group of 700 medical students I have at HMS, but I think it's slow to adapt. I mean, if I told any of you guys on the phone right now, we're going to undergo a curricular redesign, first of all, your eyes are probably rolling right now just hearing that word, but it's going to take time if we even set a small kind of curricular redesign. But soon, I would argue we have lots of data. I mean, we already have it, but it's going to only increase. Think of Epic. I mean, I could, in theory, capture every keystroke that my trainee made in Epic, everything they were looking up at the time through the partner's handbook, for example. We use Tableau within the medical school right now to bring in all kinds of learner data. We have feedback from the students on virtually everything. We also understand their clinical touch points and where they're going. We have many different scenarios about our own patient census and what kind of patients we are seeing and the types of illness. So the data are just huge. So what do I think I want in the future? What's the ask, right? That's more specific to the curriculum. I want to be informed as the kind of leader of that educational enterprise. And I want to be smartly informed. So to whom in the curriculum is really, where is the curriculum failing to provide experience? And more than that, I'd love a smart system that's giving me some judgment, actually. Where is it falling short? Who is falling short? And I'd love to actually then have it say, but there's also a proposal that you might not have seen or known. I've been able to assess the whole Brigham catchment, the whole Mass General Brigham system. And did you know that a Brookline Urgent Care Center is seeing a lot of actually kind of entry-level chest pain patients? 47% had a lot of cardiac risk factors, but you know what? A third also have no comorbidity. So when we programmed in that the ideal kind of patient that I want every learner to see is about 3 different patients presenting for a cardiac workup, a rule out of cardiac ischemia, turns out Brookline Urgent Care may be the right place to put a student, and yet I would have had no idea. That's the example that I'm hoping for ahead. Let me give you one more hope before I turn it over to see if that's reality. On that individual basis, here's what I think we have right now. We have really good students. They're really talented. They're self-motivated. Most of them simply drive their own learning and they get the most out of it. I still think we are encumbered a little bit, however, dealing with at times the bottom 10 or 20% in terms of kind of moving along that competency timeline, because they come to attention when we can flag concerns. And when we flag the concerns, they're much more often to be in one of 2 categories. It's going to be that they fail the test and we believe their knowledge base is lacking. Or I would argue it's a professionalism concern that comes up the latter 2 that's obviously picked up by another human interaction. But we spend a lot of time on the concerns where we want to make sure we address those students' concerns, even if they are really only a small fraction of the total student body. But I do think we're right on the cusp right now of identifying patterns, right? The big data that we are collecting is already showing us some big, simple patterns that can easily be identified. I also think we're quickly picking up at times that some events are very unique and we realize they're kind of the Delphian kind of process. They're signaling something bigger and we're picking up on those. So we're using the more and more data a little more effectively. And I think we're trying to figure out right now how to use that kind of collection of data, a little bit of artificial intelligence with a human overlay on it, and how does that wrap together? But here's where I think we really still have a question. What about the other 80% of our student body? I mean, they're all progressing in large part because we're giving them the venue and they're self-motivated. But boy, I sure would like to know kind of how do we delineate the differences between them and kind of push to the strengths or address their weaknesses amongst that kind of larger group, even if they're doing just fine. So that's what I want. Here's my want in 10 years. I want kind of this artificially intelligent, informed risk determination for every individual student. I want it to note concerns like in management, that they're picking up on something because they can realize that in Epic, their notes are being looked at, and for every differential, they list 12 things, but over time, they're really not showing that growth to have a smarter clinical reasoning approach. Most people are going to be listing 3 or 4 things instead of a laundry list because they're putting together the pieces better. Or maybe I want artificial intelligence to propose a human intervention. We believe that because of the repetitive nature of ordering this test or looking up this topic, that maybe this needs to be assessed a little bit more by the human world. We think there could be a concern. So make sure when Johnny, is at the next stopping point that we specifically target a unique case during the OSCE. And all of this, of course, is to promote efficiency in training. All aspects of care, all aspects of assessment. I want them to inform me when a sub-I is ready to function at the level of an intern. That I don't want to graduate my trainees at age 35 finally to be independent when I think many of them might have had the ability to do it at age 30. So wow, that's a big setup. And so here's the question before I now pull in Igal, and then next I'll pull in Nerith, which is any of that possible in 10 years? Can we really extensively analyze the data and have that level of an artificially intelligent informed output that's reliable and accurate? Igal, I'm turning it over to you to give us the answer.
Sounds good. Thank you. There are a lot of questions, a lot of demands, but the short answer will be definitely yes. It can be done, and in fact, there is evidence that it's possible in other subject areas, in other domains. Clearly, the medical education domain is very complex, and as we further in that introduction, there are so many facets, and the learning progression over years is it is a lot of complexity, a lot of variability. But really, just connecting to our presentation session number 1, when we presented some of the prerequisites, some of the important ingredients of the solution in those cases. So one, we've heard so far that it's really about optimization that needs to happen based on certain mastery model or learning progression that is kind of underpinning the whole process here, right? So we've heard knowledge, skills, and attitudes or attributes, abilities. So basically, the very important ingredient or factor in that process, whether or not it is possible with AI, related to the ability to really create this, comprehensive mastery model, right, and define certain milestones that we really are trying to optimize for. And of course, we've seen the curriculum, we've seen some of the milestones that are being established. So this is, number one requirement that seems like, is available basically for us. So this mastery model from basically, the initial baseline to, through different stages of training and curriculum that are going to be optimized for. Then the next requirement, again, in ideal scenario, in the application of AI, related to the ability to generate canonical data set to be able to train the model on, right? So this is really, I think we've heard from this introduction that the numbers, it's all about the numbers. Do we have this, big data available for us to make inferences on? And of course, we've seen in other content areas in other applications is that with the power of AI, nowadays there is no need necessarily for really thousands of data points to be able to establish this canonical data set. So it means that even with small cohorts of say 30, 40, 50 students, we can achieve that level of modeling and validation. We've heard some of the asks or requirements from AI, for example, to be able to provide some of the confidence level on the interpretation, or some of the ability to have significant ability to discrimination wise, right, for the assessment items or for certain questions, So the good news is that as part of this process of training the model, basically we are able to elicit those parameters for activities. For example, to what extent certain activities elicit evidence in what level of confidence for specific skills or attitudes or knowledge components that we are trying to optimize for. So basically, as part of this process, as we would love to see, of course, is that we do want to make sure we have those estimates on the confidence level and to what extent it will be highly recommended to have a human in the loop to make sure that this recommendation is valid and reliable. And this is really the byproduct of those algorithms. So again, short answer is yes, it is possible. There is evidence that it's already done in certain subject areas, but definitely there is a need to basically go through this process of classification and training the model and basically adjusting for different cases that can be very diverse.
So I'm holding you to a yes, Igal, in 10 years when everyone comes back. And what I'm hearing too is the importance of not necessarily seeing artificial intelligence as its own machine standing alone. That's still its overlay of how a human continues to iterate with it or shares the responsibility of intelligence is going to remain critical. Nerith, I'm going to come to you to add anything else.
Yeah, thanks. Thanks, Erik. Igal, really an expert in this area, and I think in the last session really described for us the thing which gives us the answer, which is a yes, I would say as well. And really, when he showed us the adaptive engine that they developed with Harvard X, really to develop an understanding of mastery in clinical judgment, that sort of gave us the answer. I would say that there's a no side to it. And the no side to it is, as Igal said, AI is very dependent on the data coming to it. We'll show in the next slide, I'll ask you to go there soon, but great. We'll show in the slide that AI can bring us new data, and I think that clinical educators are hungry for that. Here is, in this example, what we're showing is this machine learning, this machine learning algorithm, which is using a deep learning network with two components. One is visual learning, detecting surgical instruments in the view, right, and the surgery being performed, and then a temporal learning component, which is identifying are they happening in the right sequence. This lets this system, given the data set that it has, not only detect surgical movements, but it's also able to give a rating score, right? There's this GRS rating score, and it is 97% precise for detecting the movements, and 77% precise for the correct rating when given by experts. So that I think clinical educators be like, great, give me that, right? In these areas that are really hard or effortful or ones that I can't scale, now great, I can all of a sudden scale it and I can have every single student go as often as they need lab. That's on the yes side, and it's going to come in these areas. I would say on the no side, unless clinical educators and the people who are investing in medical school invest in the knowledge and skills and the roles that will allow clinical educators to develop skills and expertise in doing AI training and developing the data sets that do it, we're going to be left with the way things are right now, which is we come together in these giant committees and somebody is not aware of it. The computer science folks are moving way ahead, and Google and DeepMind and Microsoft and Amazon, but they're not going to have all the knowledge that say you've developed over these decades, understanding this and knowing which data really matters and which ones are most likely to be relevant. So we're going to have to see investments coming in HMS and other schools where they clearly identify, new AI roles for clinical educators.
I love that. That's great. Let me push you guys to a harder one, maybe to also gain a little more even excitement with the audience. I told you early on that I think for understandable reasons, focus a lot on knowledge, right? And knowledge acquisition, knowledge testing. But I really am also about the skills that a trainee is going to have, and also their attitudes and professional behaviors. The whole system there of knowledge, skills, and attitudes has to come together. Arguably, they're each 1/3 of the pie. So we've long anchored, though, in knowledge assessment. A test is easy to give, it's more objectives. But now we are certainly embracing much more global evaluation. And though it's poorly standardized, it's also not always consistent and reliable. It has its problems, it's good and bad, if you will. But now we have, for example, again, huge amounts of data from EPIC, also other assessments of the learner at multiple points over 4 years or more, and they're providing much greater precision and accuracy. And I would argue that we likely are having some new means of collecting data on every learner as well. Perhaps some of the processes we simply haven't tapped as well as we should, but these are starting to give more insight, not just on the knowledge, but on the skills and the attitudes. So here's what I'm asking for. Here's my hope just 10 years down the road. I would love an intelligent system, an intelligent machine to determine the patient's actual perception of my learner. And certainly we'd ground this with the patients who wanted to participate and the ethics and the limits in terms of personalized healthcare information and all that. But from the core education value it could bring, I want to know how the patient is perceiving my student. Empathy, emotional intelligence. Are they trusting them as a healthcare member? Is my student growing in that way? Boy, that's a hard thing to think a computer is able to do, right? I mean, that's humanity at its core, I think. I'd also, by the way, want that intelligent machine to determine the teacher's perception of the learner. Am I entrusting them? Am I engaging them? Are there signals of concern that perhaps can be picked up on somehow when I'm conveying some feedback into a system about the learner? And then I want the system also to deduce skills for improvement. I want it to adapt, right? I want it to react to the unexpected. Are my students also navigating high stress scenarios? These are, to me, the much higher level, more difficult scenarios for a machine to pick up on. And I'll just kind of give this example. I think most of us here who are involved in clinical medicine and education would say, you know, the most powerful assessment I get of a student is this. I send out a form to my colleague who's had the student for 2 or 3 weeks, and I call it a global performance evaluation. And in it, with different ways of grounding it or using entrustability or whatever it may be, I still say something like, hey, tell me how Jenny's doing with history taking over the 5 times, 8 times you've seen her do it, and also physical exam. Talk to me about her reasoning skills that you're picking up on. Just tell me more, right? Just describe, because I trust it. I know that after you've had a student for 3 weeks, you kind of get it. You can pick out where they're doing just fine and where there are areas for improvement. And also give me some examples so that I can feed those back effectively to the student. That is kind of this global kind of scenario. And that's the question. Can artificial intelligence emulate this? Or I'll ask the provocative question, can it do it better? Is this impossible? The intelligent interpretation of complex educational endpoints. Igal, I want this one too. Can we make this happen?
That's a great question, and we kind of gradually going into some of the conversations about limitations and in some cases even ethical concerns and so on. But I just wanted to be sure, first of all, on the bright side, what is possible. But really, this is really coming into like interpretation, right? So we were talking about classification, essentially labeling, and you might think in that scenario of more what we call affective skills or social emotional skills and detection of certain patterns using computer vision and some advances in computer vision, as you can imagine. But basically the interpretation part is really where hybrid AI plus human model is so essential. So basically in this context, we're looking into multimodal processing of data, right? So this is really what as humans we are really good at, right? So it's really about nonverbal signals that we can pick up on. And computer vision, of course, advancements in computer vision were very impressive the last, say, 5-6 years, where we can basically automatically create classifications based on this multimodal scenarios. Again, it can be teacher, student, patient situation, and so on. So the interpretation is really in most successful applications is really leading to this hybrid model where basically the AI can surface with certain level of confidence in a possible interpretation based on classification process and like prediction modeling, and then it basically leads us to the ability of the professional to assign certain thresholds for the acceptable confidence levels, and where we see that more of a human intervention is needed. So yes, efficiency-wise, it is definitely possible and from AI computational standpoint. But really, when it comes to social emotional skills, we see certain next frontier for AI to really transition from classification, prediction, and the ability to surface certain possible interpretations and recommendations to the point where we given diversity of these cases and high stakes, especially cases where interpretation is leading to certain actions. Really, this is where a lot of work needs to be done, and a lot of basically evaluation that needs to be part of that to kind of give the green light for AI applications to be like in this autonomous kind of leadway to basically provide us with a full interpretation.
The good news is I'm hearing a yes, though, more and more that we can move beyond just a simple test or a knowledge-based thing, and a computer is giving us insight into emotion and communication and connectivity in some ways. Nerith, I want you to kind of comment as well.
Great, thanks, Erik. I really like the way sort of Yigal described it, which is both like there's a lot of excitement, but then there are some challenges. And I would say a yes as well, but I think perhaps not for the reasons that you think. And then I'm going to bring some cautions to it as well. I would say that I took it as, we'll get to the emotional stuff a little bit, but I really like the slide where it says, can AI help us with complex educational endpoints? Daniel Kahneman's book about noise showed us that in most of our complex judgments, right, the errors are introduced not just by bias, but really by noise within us as well. And by introducing simple things, not even AI-based ones, but algorithms, they can improve that. We don't like those in general because they remove the human from the equation, and we feel that there's some need for it. But I just wanted to take everyone back to our first example in the first session. Playing chess is a complex activity, right? And we are now at the state that within 4 hours, modern computers can, one, learn to play chess against themselves, and in 4 hours, be at world-class level chess mastery. And then in that way, I'm going to encourage everyone to think differently about this, which is, what are the problems that we find hard, right? But that are really just pattern recognition problems, right? And then can we apply those creatively? Because we need to tell the computer science folks about this. The clinical educators are going to have insights about those. So think differently about it. But think really, I think, the way Yigal has emphasized it, which is their complex pattern recognition, no problem, right? Related to classification, right, so labeling, or prediction, and then combining that. I would say let's talk a little bit about emotional AI, because I think we really want sort of some objective way. It's one of these hard things. And this article I found very helpful from Kate Crawford, really talking about how AI is misreading human emotion, right? There's an MIT spin-out that we'll see, Affectiva, that made the claims that Erik asked for in 2014, right? There's a great TED talk about it, how computers can understand our emotion. And Erik, if we could just go to it, we'll see what their claims are. It's on this next one. We'll just watch 40 seconds.
We believe digital content and technology products are made better when they are informed by human emotions. At Effectiva, we quantify emotion to help the world accomplish this goal. We've built the most accurate automated facial coding system that exists today and can discern moment-by-moment emotional state using a webcam. This is the only neuroscience technique that can work online.
Great, thanks. I just wanted to pause it there. This is their advertisement sort of describing it. And so if I was going to summarize, I'd be like, wow, I'd sit down there and saying, great, Erik, tomorrow we're going to buy this. And then we're going to get accurate, objective information about how our learners are feeling as we're teaching them, or as the patients are interacting with them. We're going to know like how their learning is affected by this, and how the patient engagement and trust process are all going to learn this. And so why haven't we bought this yet, right? And then, I think in Kate Crawford's article, she really talked about the fact that, and as I think that everybody who looked at this, you could tell that they were faking it, right? When we talk about deep learning in computer systems, we've got tens of ones. Our neurons are connected to 10,000 other neurons. So our ability to detect this in a very nuanced way is very powerful. What the algorithms, I would say, are probably good at, even better than most, is detecting facial expressions, right? But the relationship between that and emotional states, there's a big divide. And especially if you say, great, your grade is going to be based on your facial expression, right? We will instantly get sort of a Black Mirror style effect where every student is smiling all the time, at least enough to be able to fool the system, which is not what we're aiming for. And then at the second level, I think that, I see Dr. Barak here, and he'd asked some amazing questions about bias. And this data has been shown to be biased, not just for women, but for African Americans. For African Americans, it classifies them as being angry or aggressive far more of the time, right? And so it needs to be measured. So that these emotional ones are going to have there's no strong science that there's this relationship or we have any effective measure. And at the same time, there's really knowable biases that are there. So we'll have
what I'm hearing, Nerith, is there's a yes here, but it's like a little more complicated than maybe 10, instead of 10 years, 15 years.
Yeah, well, if I could just add, the one, what's happened to Affectiva? They've been bought by another company. What does that company do? That company looks at the interior of cars and tries to understand what's happening there so it can predict when there'll be higher driver error rates. So instead of it being this general, how are you feeling and that, it's looking to see when are you distracted? And that one is one. When is your surgeon distracted? Would you like something to be monitoring that? When is your student distracted and not engaged with you? I think those are useful things. But you have to be very careful and scale back down the claims of things until we really know that they are shown to be helpful and not harmful.
That is great. Time is going to run short here, so we're going to take just a minute or two on the complexity, because I'm going to still end with the inspiration of what could be that lies ahead. I know the layers of this are many, but also realize this: when a teacher, that's us, is given intelligent data from a machine, right, that confidently predicts how the learner or the system could benefit by changing, emphasizing, integrating, deleting something, right? Think about this. Can the system in which we work, which is still very much a human operationalized system of healthcare, how quickly can we adapt to operationalize a change that a machine is telling us? That's still a whole other level, right? And what other forces will always be at play, political, economic, or otherwise? There's always barriers, facilitators to everything. And also this: what if artificial intelligence, what if a machine confidently confirms a finding that we just still don't believe is accurate? We just maybe don't want to believe it. And there's so many ethical considerations. So I'm planting the seed here to the complexities that exist. I'll just pull Nerith in. Anything here I'm missing, or 30 seconds on this very loaded slide here? Could be a whole talk itself.
No, I think, I've got the AI ethics book. There's a huge body of emerging literature. I would say one of the ones that concerns me the most, in which we are actually getting data, is this automation bias in clinical decision support systems, even within the hospital now, when physicians are not getting alerts about drug interactions, they're stopping thinking about it and trusting it. And that's a big concern, even in very simple sort of just, reaction systems. So I'm glad that you highlighted here, because I think it's going to be a big issue.
This is the provocative question. If Watson, the intelligent system, were asked to intelligently design a full medical education curriculum de novo, brand new, driven only by macro and micro learning objectives. So we'll set and tell it what we want it to do, but also the available infrastructure, the opportunities, strict reliance on competency-based advancement, and data from any and all technology we have. And by the way, there's no cost constraint. That's why I love giving this talk. I have all the abilities to push the limits. But ask yourself, what would it produce? And perhaps it would be a better trained healthcare worker, and perhaps someone who moved through a better learning experience. I don't know. I think there's power to it. It's hard to know and read the future, but to think that there won't be some impact, I think, is a mistake. So with that, that was just a 10-year vision, and I hope we all meet back in 10 years. But I wanted to thank everyone on this call for simply opening your mind to what could be ahead. And a real special thanks to Yigal and Nerith for helping us realize this is more than just a possibility. And I'll ask you this, were my hypotheses, were my hopes for 10 years from now different from yours, right? Because we'd have to come to a collective agreement then on where we want AI to go. And I just welcome everyone to add in your thoughts. And with that, we have about 5 minutes for questions. I welcome anyone to enter anything into the chat or questions at all. Maybe I'll start actually with Christina. Is there anything provocative from the chat that we should address or comment on?
Yeah, we got a couple things. I think it is Sue was sort of talking about the challenges of assessing things that some might consider soft skills like communication and whether that can be enabled through artificial intelligence. And then we've got a really great comment from Dr. Paul Barrich, who is sort of saying we really have to think about culture. We really have to think about human factors and systems. And the focus needs to be on safety, 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 safety for everybody involved. So those are the two things that I noted in the chat that I thought were really interesting today.
Yigal, Nerith, any comments there, responses? Thank you, Paul, for that comment, by the way.
This is a great observation, clearly, as we move from the cognitive knowledge and skills into more of a social emotional domain. There is more of a challenge. I would say, in many cases, what we see as a major limitation in that space is reliance, or like pretty much full reliance on self-report type of questions and tools. So definitely we see in the last few years advancement in that space where what we know is strong. For example, situational judgment testing items, self-report, when you're presented with certain scenario and there are 3 or 4 options that are not necessarily represent just the one correct possibility. We know this is one of the strongest items in self-report, but we also see that recently more of artificial intelligence driven scenarios that do more of a multimodal situational judgment kind of a stimulus and provide data on basically outperforming this type of item. So it really depends very much on what are the existing measures we are using and what are the limitations of those measures compared to what additional data and inference we can draw upon based on those new AI applications as well.
Absolutely. Other final thoughts? I just would draw everyone's attention to also some of Paul's great comments in the chat box as well. I'll even read one. How can it be used, AI, to better support learner handovers from course to course or year to year? I like that idea a lot. Or to improve the current situation and how we hand off information, which is so frequent in training, but also just in healthcare in general. So that's really very powerful. We have 1 minute left. Any last thoughts or comments? Bob, I see you on the call. Thank you to Cullen and Alicio, everyone for joining here today. With that, I want to thank everyone. I do invite you back for really 2 of the more interesting talks we have ahead. They're going to be far better than the one I just gave, but it really is going to be industry leaders in using this in education. And I want to invite you to see how they're actually applying it currently out in the real world with many different formats for education. So with that, thanks to, again, Yigal, very much. Thanks to Nerith for helping put this whole series together. Thanks to each of you for being a participant. And we look forward to seeing you back in about 3 to 4 weeks. Have a great day, everybody.
Thanks, everyone. Bye-bye.